Hello friends, I am Dr. Farah Ingale, Senior Consultant Physician, Diabetologist and Director Internal Medicine, Fortis Hiranandani Hospital, Vashi, Navi Mumbai. Today I would be talking on diabetic foot care. Now diabetes is such a disease which everyone is aware of, even the school going kid. Recently I met a school going kid who told me the definition of diabetes, that is when the blood sugar level goes high, that is fasting more than 110, post lunch more than 140 and HbA1c of more than 6.5. It is called as diabetes. That is what the child told me, and he was very right. And everyone also knows that diabetes is one such problem which can affect you from head to toe. For example, you can get strokes, which are 4-5 times more common in diabetes compared to non-diabetics when the sugars are not under control. You can get heart attacks, also silent infarcts without any symptoms and signs, which are 2 times more common in diabetics compared to non-diabetics, kidney failure, and many other serious complications which can happen in diabetes, which many people are actually aware of and are scared of, and they take precautions to prevent these complications. But one neglected entity is the foot care. People do not pay so much attention to the foot, which in fact is a very important part of our body. To look at, it's a small foot, but we stand on it, we walk with our foot. If our foot is affected, we will not be able to walk. There are complications that can happen in diabetes called as diabetic foot complications. Now, diabetes can affect the circulation to the foot by affecting the vessels of the foot. It can affect the nerves, that is called as peripheral neuropathy. A diabetic foot, if you take, now foot basically a small structure. Each foot has 26 bones, 33 joints and about 100 muscles and cartilages, which can all get affected in the foot problems because of diabetes. The shape of the foot, the structure of the foot can change. So it's very important that you take proper care of your foot to prevent the complications related to the foot. So it's important that you use a proper footwear which is properly fitting, comfortable, soft, usually made from a special material called MCR material. Now if there are corns or callosities and even ulcers which can happen in a diabetic foot, you have to have a customized foot care where we need to offload the affected area. So that is very important. And even inside your house, you should use a soft slipper. Do not walk barefoot, because as your nerves are affected, the sensations of the foot get reduced, and if you get hurt, there's a trauma you may not understand. Then there will be a wound which can get infected if the sugars are not under control, and many a times we have to amputate the foot. 50% of non-traumatic amputations are because of diabetic foot problems. Then secondly, you should always keep your foot clean. Wash it with mild shampoo. Dry it up after washing, and especially the webs between the toes should be kept dry, otherwise you can catch up fungal infections. Foot skin should not be dry. It should not be, it has to be properly moisturized. So keep on moisturizing, otherwise the dry skin can cause cuts, and that can also get infected. See, today what we know is mobility is longevity. You keep walking. If you need to walk, your foot has to be proper. So it's important you take proper care of your foot, as I've said, by wearing proper footwear, washing your feet, keeping it moisturized, and of course to keep the sugars under control. Otherwise these problems are caused usually by uncontrolled diabetes. So do follow a healthy diabetic diet, go for walks with your healthy foot, and also do regular checkups and consult your doctor from time to time so that your sugars stay under proper control and you do not get complications. Always put your best foot forward. Thank you.